Doctora Clinia Seguerra. So, Doctora is a family medicine, family med. Okay. She has always been invited to give talk and answer questions regarding Iteracare. So, give now the floor to Doctora. Doctora, I understand that you have to leave before 9. Okay, so we have a very short time.
Okay.
Doctora, would you start us on how do you how do you get to know about Iteracare and how has it blessed you?
Okay. Okay. Hello, everyone. It is really my privilege and honor to be invited here in your Zoom meeting. It is always an honor and a pleasure for me to be able to help people. So, with regards to the product, I came to know about it when it was introduced to me by my friends who are now also my uplines, and they are Christian and Jasmine. We way back we knew each other way back more than 10 years ago, and at that time we were also business partners in doing scalar energy. So when they and scalar energy is really a great help, and I have been blessed so much with scalar energy. So when they introduced me to terahertz, to the Iteracare, which also has scalar energy in it, the brand name of which is Quantum, I did not hesitate in opening my mind on how it will help or how it will benefit our health. So when it was introduced to me last October 4, I immediately used the device. And that was last year. And now it's about July is about to end. And I have been experiencing really its benefits. And I can't help to share it with anyone who would who would be willing to listen to the benefits, to the health benefits of the Iteracare device. So that's it.
Okay, thank you very much, Doctora. All right. Um, I invited the Doctora, of course, through Jasmine, and for a very short notice, Doctora accepted my invitation. So blessed with that, no? Because I want you, no, those of you who have still skeptic until now, or still don't understand why you are doing this, what for, what are your concerns? Is it going to help? The floor is now open. Okay, who would want to ask question? Can you raise your hand?
Also, while everyone is still thinking about a question, I will tell you my experience with Iteracare. So I am now 70. I'm 70 years old. But when I was 52, I was diagnosed with multiple cerebral infarction, meaning stroke. And I had been taking 12 to 13 different kind of medications for that condition. And it went on for 6 years until when I was 58, Jasmine and Christian introduced to me scalar energy. You see, I readily embraced scalar energy because at that time there was nothing else that I could take, and still I was not getting well. So when it was introduced to me, I embraced it, and it has improved my health. And from 58 years old until I was about 62, I was medication free. But then after 62 years old, at 63, my blood pressure started to came back, increasing. It started increasing again. And so I started to take medications. And then I noticed that I was on monotherapy, and then it became double, it became a combination until I was already taking 5 to 6 medications to control my hypertension. And that was last year in 2021 when Jasmine and Christian introduced to me the Iteracare device. So immediately I used it. And the next day, the next morning, when I woke up with a headache, and my blood pressure was 160 to 200 over 100 in my diastolic pressure. So, but before I got the device, I was already told about the Iteracare, and so 1 week before I got the device, I started searching about Iteracare. I was so curious. I said to myself, this would have to be um, the only remedy, because I have been given already the best drugs, and yet my hypertension was still out of control. So I never hesitated using it. And in my research, in my readings, I knew about the healing crisis. So on the next day after I used the Iteracare device, and I had started feeling um, headaches, my blood pressure was high, and I felt like I was vomiting. I knew that it was a healing crisis. And so I just got myself some medication. These are medications that we would usually give to someone with a hypertensive crisis. And immediately, it didn't take 15 minutes. I felt well again. I responded so fast. And so that started my journey.
Thấy không? Thấy bay rồi bạn.
Yes. So I did not stop using the Iteracare device. I monitored myself. And by this time, instead of taking 5 or 6 different kinds of medications, I am now down to one pill combination. I do still take my medications, but I'm taking just only one pill, and it is one combination. I have discarded the rest, and I have also been monitoring my laboratories, and they are really beginning to be better. So I'm still a work in progress. I hope to be able to eradicate this taking of maintenance meds, and I can feel that my body is getting stronger. It's responding to the decreasing medication, and to my exposure to the Iteracare device is getting to be less frequent. I used to blow myself for 1 to 2 hours, but lately I just blow myself every other day for 30 minutes, 45 minutes, and the results are really amazing. So that is my story. I haven't told you yet the stories of my patients.
Wow. We have, we have
Okay.
more to hear pala from Doctora, if ever. Wow, amazing. So,
Yeah.
Doctora, you talk about the healing process.
Yes.
Actually, that is the major concern of everyone. Bakit pag blow ko, biglang nagrabe pa ako?
Yeah, that's right. And I think when we were very new with the Iteracare device, I had some friends who started using it, and they had catastrophic they had catastrophic results. So now we are learning about how to use the medication, the Iteracare device, which contains the terahertz energy, that we should introduce it to our body slowly. 15 minutes at first exposure, and then maybe by the next day you go on 20, and the next day you go on 25, until you can tolerate the 2 hours, or you can divide the 2 hours exposure per day to 30 in the morning, 30 at midday, 30 in the afternoon, 30 at night. But that will have to be later. I was really, at first, I was only dependent when I studied the Iteracare energy. I was only dependent on what I would I was able to gather from my readings, and it will usually it will usually direct me to traditional Chinese medicine when I search for the terahertz energy. And most of the literatures, when I look into them, they were in Chinese, and although there were some in English translation. So I have a device in my phone that can translate. It can translate Chinese, this technology thing. So I got knowledge from all of that. But there is a lot of of you know of readings to cover if you really understand the Chinese, if you know how to read Chinese. Many of it are in the books that relate to traditional Chinese medicine.
Wow. Doctora, we have someone here who can do that for us. We have
Yeah.
here Pastor Harmony here. That Harmony, that is our church pastor's wife. She's a
Okay.
pastor herself, Pastor Harmony from
Okay.
China.
Wow,
So
that's good.
maybe she can do it for us.
We have actually, there are 62 or 61 clinical trials. They have been talking about it. Even Noor Rashid had talked about the clinical trials, but they are in Chinese, they are in Mandarin. So it's very hard to, it's very hard to digest it if you cannot read Chinese. So
Yeah.
I had to depend on the little translations that I could make on, and then I'm lucky if I can get traditional Chinese medicine in English. But I really would love to get hold of those 62 trials, which are in Chinese, probably Mandarin, that Noor Rashid talks about. And if we could read through it, maybe we could, I'm certain we would discover the secrets of how
Learn more.
really that Iteracare device should be used and
Mhm.
properly.
If we can get clear copies of that, Doctor, I think that wouldn't
I
be
have
a
asked
problem.
my appliance
Uh-huh.
to even if it's just a soft copy,
Mm-mm.
just a
Yeah,
soft
just
copy,
a soft copy.
the hard one would really be,
Yeah, just a soft copy na clear. Kasi there are some
yeah.
who are just
Oo.
a screenshot. They're not readable. Eh.
That's right. So maybe a soft copy of the 61 clinical trials.
All right,
I'm
that's
sure
good.
that it will really open up the gate for a lot of knowledge. Right now, we are just depending on our experience and
Uh-huh.
what we can talk about when we do our Zoom meetings.
I see. Okay. So, first question I'm always being asked.
Okay.
Many people are saying that the blue light is bad. How come we have blue light here?
The blue light is used by dermatologists for cell therapy on the skin. And when we use the Iteracare device, we apply, we blow it on our skin. So with the blue light will take care of the blemishes. It will soften the wrinkles there. You know, that's the function of the blue lights. It is really, since I could remember, it is really used by dermatologists to make women and men and human beings beautiful.
And how about eyes? Is it bad now when we always looking at the blue light?
Um, the you see, the eye is made of epithelium, and epithelium is what composes the skin. And what when I listened, when I watched the presentation of Noor Rashid, Noor Rashid said that it is safe to look at the blue lights. And I have been doing that. I have been doing that also. I look at the blue lights.
Oh.
According to Nathan, by the way, he said, Doctora, that the blue light is only a target light and has no negative effect on our skin. Like it's just the Iteracare blue light is just parang you know that you are directing it to your armpit, directing
Yeah.
to this.
Yeah.
So,
Pointer.
That could be one use, but it's not just the only one. It is
mm-mm,
really being used in dermatology.
mm-mm.
Wow.
It can also be a guide where you are hitting the target, and it also has a beneficial effect on the skin.
Yeah.
Wow. Wow.
Okay.
Wow.
Mhm.
So good. So nice.
Yeah.
Right. Okay. So, who has question now?
You can also use our chat box. If
Yeah.
you are shy to
Ganda,
unmute, you write it in the chat box.
yeah. Let me just ask first for in behalf of someone. She's diagnosed with a hypothyroidism.
Mhm.
So how is this going to help?
Yeah. The function of the terahertz energy is to repair. It will repair the cells so that they will begin to work normally. They will begin to work what is their intended work. Every cell in the body has its own function. In hypothyroidism, the problem is you have less of the hormones or the thyroids. So it is because the thyroid gland has gotten lazy. It's not producing enough hormones to put the person at the person's thyroid hormones at a normal level. So if you stimulate it with energy, give it energy, then the thyroid hormones, the thyroid cells will start producing the hormones. They will start to do their work. And it's the same thing with diabetes. In diabetes, you have less of the insulin, the natural insulin that the body produces, because your pancreas has gone lazy, no energy. So if you feed it with energy, then they will go back to work and produce the insulin hormone. That's the function. So actually, in all organs, that is how the terahertz energy will work. It will provide the energy supplement that the cells need so that they will do their work. And that goes for everything, the brain cells, the heart cells, all of it, all cells in the body.
Okay, so carry all, huh?
Yes, that's right.
Wonderful.
That's right.
Yeah, okay, wonderful. Is the hot more effective than warm? Is the cool off option useful?
I think that will only have to be on how you react. Some people are have allergies to the hot temperature. Some people have allergies to the cold temperature. So it does not matter which would you prefer. If you prefer the hot, then go for the hot. If you prefer the cold, go for the cold. What's important there is you are delivering terahertz energy through the device to your body without the side effects of radiation, because quantum or scalar energy neutralizes radiation, and we can test that.
Okay, thank you. Someone had a fall uh, quite some months ago, had been going through therapy. Uh, she's using already Iteracare, but for almost 2 months, but I think has not improved so much. What could have been the difference? What could have been
How old is this person who went for?
late 60s?
Well, I also had a fall sometime in June. Yeah, towards the end of June. I sleep on a wet floor. The in the place where I work, and it was raining the night before, and the roof has had there was a hole in the roof, and it went right through the floor. And I reported for work early in the morning. My I have an academic load in one of the medical universities here in Cebu. So my class starts at 8, but between 7 and 7:30, I make sure that I am already in school. And I think the janitors haven't yet swept off the floor, the wet floor. And when I stepped on it, before I knew it, I was already on the ground. I hit my arm and my buttocks hard. So what I did, but I was able to immediately stand up. You see, I had been using the Iteracare device since October last year, and I had my fall about more than a month ago. I didn't feel any pain at first, so I was able to get up and got into the faculty room where I keep one device there, which I share with my colleagues, fellow doctors. Whenever one has a headache, whenever one feels like he or she is having a heart attack and there's pain in the chest, I blow them over and they get relieved. So after that fall, I was able to get into my office and I immediately blow on myself. And fortunately, I think I'm a bit my arm started to swell immediately, and then my buttocks really was the one who got hit hard on the floor, and it was so painful. I blow on myself for about 30 minutes, and the pain was gone. Then after a while, since it was early in the morning, I was able to have my class. When I was about to go home in the afternoon, I felt the pain again. So I had to take in some medication, what doctors would prescribe for pain, and some shortcuts so that the pain would immediately be removed. But when I got home, I really had to take a bath in the Iteracare energy. So I was relieved of the pain and the discomfort, but even until now, it still keeps coming back. The pain on my buttocks and the pain on my arm, but the 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 length of time that it takes to be gone is getting shorter. It's getting shorter, and it's now being less of a bother.
Right. So
That is my experience with a fall.
okay, it will take a while, no? It's not
Yes.
immediate.
Yeah, but you would feel that the pain is getting lesser, and the length of time that you feel the pain is with you is getting lesser.
Lesser also.
Yeah, that's right.
Ah, all right.
Just
Okay.
continue to encourage lang, Juliet, si
Yes.
yung friend mo. Just
Oo.
keep blowing.
And
Kasi,
if it is really that painful, it's really uncomfortable, we can use drugs because these are only temporary.
Pain
Just to
reliever
relieve,
drugs.
that's right, pain relievers and anti-inflammatories, they help.
Okay. Kasi fracture kasi siya eh.
In one of the literatures that had been shown, there was a guy who had a fracture on the head. I wonder if you have seen that in one of the presentations. He had an accident, and then he had brain surgery because there was a clot inside the brain, and then they took out the clot, and then they of course, to get into the brain, you have to break open the skull, and when after they remove the clot, they have to put everything back, and so the bones were already in pieces, and they have to tie it down with sutures, and the back of his head, where they opened up the skull, was really, it also looked shattered, but he continuously used the Iteracare device, and I think it was about 2 months. The the head has returned back to its normal shape, and
Wow.
that's beyond being fractured. Okay, they really had to break the bone open and then tie it back with sutures to 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 finish the surgery.
Yeah. So that's an intentional fracture. Ah.
Yeah, it was even intentional. That's right.
All right. Okay. So takes a while. Okay. Follow-up question. Do we need to put some lotion before blowing in hot temperature to protect skin?
Well, in my experience, I usually blow after I take a shower at night. I usually do the blowing at night so that I don't have to mess with water anymore. So I put some lotion, some, not really the cream ones. This serum kind of yung may serum, like facial serum, whatever. It's liquid, it's not cream. You put it on the face, and then after that, after a while, I blow it with the least hot temperature. And I think it's okay to put something on before blowing, as long
Okay
as
to
you are comfortable with the heat or
okay
with
to
the
put,
cold.
but not necessarily, Doctora.
Not necessarily.
But
But
okay
I
naman.
think it has added benefit if you put
Ah.
in if you put in something before you blow, especially on the face.
not after, Doc, no?
You can
You-
also put some after blowing.
Ano, Kat, I put ASEA. Renew. I
It's
put
either
renew.
before or after. It really depends on you.
Yeah, I was telling Charlie, I'm using renew also. Yeah. All right. Okay. So, okay. One more. Okay. We can blow around the head, but not on top of head, right?
Yeah,
No, no.
you have hypertension.
If you have hypertension, you cannot blow on top. If
Yes,
none, can.
you can. But I don't think there's really a need to blow on top because when you are blowing from down, it will penetrate, it will go up. But in the literature of the Iteracare device, there was a don't, no? don't don't blow on the crown if don't blow on the crown if you have hypertension. They did not give a reason in English, but I got the reason in Chinese traditional in traditional Chinese medicine. It has something to do with the meridians, and the meridians and the passageways of energy.
Mm.
Yeah.
Yes, thank you, Doc. I have a friend who had an accident and he has a big painful hit on her head.
Mhm.
Tapos na-admit sa hospital, tapos nag-lower yung oxygen. Is it safe to like that? Like to blow in sa head?
As long
Parang
as
there's bleeding, ganyan.
you should let the bleeding heal first.
Mm.
I think the reason there is um, when there is an acute injury, especially if there is bleeding, the tissues, the cells are really in disarray and it cannot heal. So you can blow on the outer portion,
Sa body niya lang.
on where the injury is located. Let's say if the injury is on, let's say, on the face, not you can blow not directly on the injured area, but you can blow on the areas around because the cells there are intact, and then they will be the one to send in some reinforcements to the cells that have been injured.
Mm.
So the body will take care of itself. The body has its own way of maintaining normal. We call it homeostasis in medicine. So the body will always do its best to balance everything. And with the energy supplement that it will be getting from the terahertz energy, which will help the cells to reconstruct, then that's where great advantage will be seen.
Right.
Okay.
So that's good. Okay.
Yeah.
And then, Doctora, there's another one. With lung cancer. Okay. I think it's stage
Four.
stage 4. Yeah. And has metastasized to the brain. Had one chemo already
Mhm.
recently, just few days ago.
Mhm.
But I sent already the Iteracare 1 month, I think about a month ago. She's been using it. And how is it going to proceed? After having one treatment of chemo already, I think that the plan of the onco is to have 3.
Actually, when it comes to questions like that, um, the palm, our palms, and the soles of our feet, yeah, there are certain areas in our palms and in our feet that are represented by the organs in the body. So if the patient has lung cancer and metastasis to the brain, if you cannot blow on the lungs and on the brain, blow on the palms and on the soles of the feet. Look for the area in the palm where the lungs are located. And you can do the blowing from there. And on the soles of the feet, where the lungs are located and where the brain is located, you start blowing on those areas because those areas will connect to the organs. They will send the terahertz energy to the organs. I got this from the meridians, from my readings from traditional Chinese medicine. In English, they did not give us any reasons for that.
So that's true to any organ illness, Doctora, not just the lungs and the
Yes,
and the brain.
yes. Even if there are times when you are not really so flexible in blowing yourself, it's difficult to blow the back. It's difficult to blow the lumbar, the spine. This area, you know, from the lower portion of the nail up to here, this is the area of the spine. Yeah. Here, lower portion of the nail down to the wrist. That is the area of the spine. So if you cannot blow your spine, blow on this area. And on the feet, if this were your big toe, no, if this were your big toe, let's say this is your feet, and this is the sole of the foot, and this is the big toe. The area on the side of the big toe represents the curvature of the spine. So you can also blow on those areas. So both on the hands and on the feet.
Ah, Doctora, this is good for me. My
Yeah.
scoliosis. I like that. I like that.
Yes. And I got this from traditional Chinese medicine.
All right. Okay. I think, di ba, Kat, Doctor, di ba we have a picture of the
In
soul
the
and the
reflexology chart. Yeah.
chart. Di ba we have a chart?
Yes, we do have a chart. The reflexology chart. You can show it.
Yeah.
Reflexology chart. I'll check, huh?
Yeah.
Yeah,
Look
we have
for
a chart.
there are drawings of the various organs
Yeah.
on the palm and on the soles of the feet.
I think I sent to most of them who have. I think they have it. Yeah. You check your phones, huh? I'm sure I send that. No?
And even on the sides, there are areas for the uterus, for the vagina, for the prostate, everything. These are areas that you can blow
Wala
on.
ka, wala ka, ano
Diba?
ka?
Oh, wala.
Wala
Look for
ikaw.
you can look for a reflexology chart in the web, in the internet.
Reflexology chart.
Yes,
Okay.
you can use that. These are acupressure areas. These are the ones that they will press on when they do acupressure, when they do reflexology, when they do massage. But this time, you don't have to go to massage anymore. You just blow on those areas.
Oh,
Ito,
wow.
doctor,
Yes,
blow.
Yes,
Kasi,
yes,
and kanina I said about the ear. It's good also to blow behind your ear.
okay.
Kasi nakakonect
Yeah,
din.
that's right.
No? Circular.
Doktora, yung hearing loss, poor hearing na, age-related.
The foot dito.
Actually, you just blow on those areas. Can you look for the ear?
Back to the ear.
The ear, I saw the ear on the foot, on the
Yan,
little,
yeah, okay.
little toe.
Saan?
Sa ano, sa feet.
Reduce
Balik tayo sa feet. Okay.
Hands muna, hands. Yeah, you get back. There is an area for the ear on the second, on the fourth and on
Antonos.
the fifth finger, fourth and fifth finger, and it is on the first phalange.
Oo. Okay.
That is the area for the ear. So you
Mm-mm.
can blow that. You can blow on those areas and it will cover the ear.
Okay.
Ah, this one, the ear
Ah,
area, this
Yes,
one, the
yes.
ring finger, this part,
The ring finger and the small finger.
and this one, no?
That's right. That's the
This
one.
area and this area.
Yes.
If there's something you have problem in your ear.
Yeah.
I
And
think
you can also blow directly on the ear. But if it is not comfortable for you, you can blow on the palm of your hand or on the sole of the feet. Let's look at the sole of the feet. There you are.
The third,
The ear is on the fourth
dito fourth,
toe.
sa right.
That's the one.
Sa right foot sa fourth. Sa
Yeah, and
left
on
foot,
the
dito
left,
siya nakakot. Ah, ear, ay
ear.
para yan.
The
O
ear,
sa
yeah.
fourth ear. So sa
And
hand, sa fourth din siya, sa ring finger.
yeah.
And sa foot also, sa fourth din. Okay, from your toe.
So sometimes when I feel so lazy to be blowing myself all over, I just blow on my feet and on my hands.
Actually, may testimony pala, Doc. Yung ano ko, hernia. Kana mag-oo, mag sometimes may blood na lumiit.
That's
So
good.
that's something that encourages me to share to others. Kasi it will need medication pa or operation.
And you don't
I
have to
save a lot
do
of money by just blowing.
Uh-uh.
Oo.
The body needs support, energy support, so that it can go back to do its function. And then when the cells are energized, they will just fall into place.
So we will give you, to those who are attending, please message to send you this one, huh? So you can know if you have heart disease, 20 to 30 minutes, where to blow. At see, this is your
they have
part,
na.
no?
They have na.
They have na
Actually, those
also.
who have the Iteracare, they have this.
Okay, for beauty din, pwede rin. But you can use the middle part, no? Yung low heat, low,
Yeah.
ano, yung,
The medium.
kasi may first yan, yung medium, second yung low, and third yung strong. Yan, for colds, cough, flu, asthma, sa ganyan.
Yeah, that's right.
Sige, Doc, you can continue to share. I just scan it until the
That's
end.
right. Those are the areas that are really affected.
Armpit, breast area, back.
And you know, when I wonder if you have felt when you are blowing anywhere in your body, especially in my case, when I'm blowing on my legs, I feel something itchy and wherein you just love to scratch. So you just blow on those areas and the terahertz energy will be the one to scratch the itch and the itchiness will go away.
Actually, that is Charlie's problem. Charlie?
Anong problema? Anong problema? Ulit?
Anong problema mo? Yung itchy mo? Itchy. Doctor is telling you about itchy.
Oo.
Just blow on those areas.
Na,
You don't have to scratch them. Just blow on them. Let the terahertz energy scratch it for you.
okay.
Yeah, and it
Pwede
also
ba pa-screenshot ulit?
and it also means if you feel something itchy, that the microcirculation under the skin is compromised. So when you blow it with the heat, the blood vessels will start to dilate. They will open up, and then they will remove the itchiness. That's how it works.
Okay. Okay.
Call your attention. Will you hold on to the feet?
To the feet
Go back
now.
to the feet, yeah. You see there is a pink dot.
Yeah, oo. Yes.
No,
What's that,
there's a
doktora?
can you show it?
Dito? Or
Hindi.
kanina? Sa
Kanina,
baba?
akit.
This will do.
Kanina pa.
This will do also.
Yung
This
dilaw
one?
naman.
At the center, yeah, there is a line that
Solar
goes,
plexus.
yeah, there is a line from that goes sideways. That is
Okay.
the diaphragm. That is the
This
diaphragm.
one?
This white.
That's right. And on your palm, there is a crease on the upper portion. Yes. On the
What?
upper portion, there is a line that goes sideways. That is also the area of the diaphragm. So if you have, the diaphragm is the muscle for breathing. It is the one that pushes the lungs and pulls it back so that air can go out, and when it pulls it back, air gets in. So if you have difficulty on breathing, you can just blow in those areas, on the palm
This
and on
area?
the soles of the feet.
This area.
Yes. Mhm.
And sa feet, this area.
Yeah, the line, the upper line.
Yeah, yung puti.
Yeah, that one, correct.
Yeah, right. Okay, so pay attention to what I sent you, ha? Kala nyo lang colorful chart, ha? See? It's very functional.
That's right.
All right. Doctor said no more pag-asa.
Bronchiectasis, you just blow on the lungs, and the lungs will just remove the debris.
Kasi every night, every evening may plema.
Yeah.
Yes.
The lungs will
Doctor-
just open up. You drink also a lot of charged water.
Mm.
So that
How many charged water do you drink, Leslie?
Sometimes during my when I'm going to blow,
if
That's what
you're
2 glasses.
if you do not have renal failure,
Wala naman.
the normal amount of water that we should be drinking is 3 liters
3 liters.
every day. Yeah. I
Sabi ako,
usually
nakakatu.
consume that much.
Talaga?
Maybe 1 liter within 8 hours. There are 24 hours in a day. So you divide it into 3. So you have 8 hours to consume 1 liter. And it's not just water alone. That will include any liquid that you will take in.
3 liters is only 12 glasses.
No,
Liters.
Yes, 250 ml.
1 liter is
1
1,000 ml.
250 is 1
4.
glass eh.
Hindi, depende sa laki ng glass. Standard
Yeah.
glass is only 200.
So if a standard glass is 200,
Yes, oo.
you need 5
Okay.
glasses
Same.
to make 1 liter.
15 glasses.
That's right.
Kaya
15.
yan.
She's my
Kaya
sister.
Drink
Evelyn is
charged
my sister.
water. Drink charged water. 1 liter in 8 hours, Gamayra, it's still small amount.
Oo, kaya yun.
Kaya
Isang
yun.
inuman, 2 baso pa yun.
Right.
My sister drinks a lot of water.
Mm.
Yeah, but by the way, I think we asked na the last time, no, about Len. My sister's the one who had finished her chemo and radiation on breast.
Mm-mm.
So in remission siya ngayon for several months already. Pero how's ba your back pain, your leg, your sciatica ba? How is it?
Improving.
That's good.
Mm-hmm.
You should really be improving. If you use the Iteracare device, you should be getting younger every year that passes by. Instead of getting old.
Actually, I'll share you one thing na yesterday I renew my passport in MOA. Okay, so when I get there, it's 4 o'clock in the afternoon, as there 3:30. I show my appointment. 4 o'clock. Okay. Tapos, she got the paper. And then give it back to me. Sabi niya, okay, pila ka na doon. Ito dun. Okay. So I proceed. So I go there and make pila.
Oh,
And then just somebody shouted, "Ay, ma'am, ma'am." I said, "Ma'am. I think parang wala yatang ma'am dito. Parang ako lang yata." So I turned around. Sabi, ma'am, sandali po. Ay, senior na po pala kayo? Sabi, ma'am, dito na kayo. Ay, akala ko kasi hindi pa kayo senior. Wow, kita
that's a
mo.
good point.
Oh, ayun, just
Good point.
ano
You
lang.
really do get younger. The wrinkles on the skin will be wiped out.
Mhm. Yeah.
And you will
Okay.
tend to move lighter. So you do not move and act like an old person.
Pero doktora, me, no, I feel parang ako I feel always sleepy. I don't know why.
It means that you still need a lot of sleeping so that when you sleep, it's when the body does its healing work.
My friend who got the unit, I've been calling her. She cannot sleep nga eh. Hindi sumasagot ng phone. So you should come because Doctora is here. Okay, actually last Monday we were having exercise. So yun, they comment about my face nga daw. So what did you do to your face? So sabi ko, ay, baka ito lang Iteracare. Sabi niya, what is that? Sabi ko, yan lang, ganito lang, blow lang. Will you send me that one?
Yeah, that's
Ganun
good.
lang.
That becomes a talking point.
Oh, I
for
asked her to
starters.
join. And our problem is she could not sleep.
And is she already using the Iteracare device?
Not yet nga kasi hindi nga siya marunong.
She's
Sabi
got
ko
to
nga,
have. She's got to have the Iteracare device.
so saan siya magbo-blow? Particular for the sleeping.
For sleeping, it's at the back of the head. At the base
May
of
high
the
blood
neck.
siya, doktora.
I
May
think
high blood siya.
no, at the back of the head, not on the crown.
At the back.
The back
Oh,
of
at
the
the back.
head. Yeah.
Not
that-
here.
At the lower portion of the neck. Yeah, that's the one. That's
Neck.
that one.
Yung sa basic.
Yeah.
We have the basic cut.
Mm-mm.
Yung yellow.
Yung
color yellow.
basic for a while,
Yeah.
ha?
Oo, the basic.
Mm-mm.
Yeah.
Nandito
Okay.
basic eh.
We have also nandito pa ba si Jem?
I'm here.
Yeah, okay. In a while, I invited also one of our friends, Gemini. She's an acupuncturist, also a naturopath, no? Later, she will share also. And then maybe we can ask her about the acupuncture also, kung how it's going to help. Okay, Doctora, you were talking about this upper back?
Yeah, the one
Number
with
7?
two dots. Yeah,
Number
number
7.
7. That's right.
For sleeping.
Yeah, for sleeping.
All right.
Mm-mm.
Okay, that's good.
Mm-mm.
Okay. Anyone else?
Doktora, you have other advice where they start? 'Di ba kung bago pa lang, they start with these 10 acupuncture points and then where will they start? Low heat
It depends on
or low speed, low
where
heat?
you are comfortable.
So anywhere lang.
You can start anywhere.
But maybe for your anus, for your face, use low speed, low heat
Yeah,
ha.
I know
Kaya
you use that.
mapasok ka tayo. Kung kaya mo i-tolerate, then you go for high speed. Usually, pwede yan sa back mo.
You
Spano.
can
Pero
also use your
usually, high
heel.
speed, ha?
You can use your heel as there is an area for the genitals on your heels.
Oh, I see. Mm.
Starters.
Okay.
Go back to
Pero-
your reflexology
Pero sa back
part.
talaga, Dok, effective to sa akin sa hemorrhoids eh.
Yep. It does work.
Okay.
Hey, okay, I think Doctora is about time. Anyone else?
Yeah, I'll just see you
Like that-
another.
Okay, so
Another
some other time, we'll advise you earlier, Doctora.
Yeah,
Yan,
but
ano.
it's okay. It's okay.
Yeah.
Maybe before you leave, Doctora, last few words or what? Anything you want to encourage?
Okay, so what will I say? Our Iteracare device is actually sunlight in a tube. It's the morning sun from 7 o'clock in the morning to 8 o'clock in the morning. It's the most nourishing part of the time when the sunlight, the natural sunlight, nourishes the earth. And that is what we have in our Iteracare device. So there are no contraindications. Anyone can use it from newborns up to the not so newborns, the extremes in ages. So it's really
Alright.
important that we do get sunlight, because at this time in our age, sunlight is not so available as often as we would want it.
Mm.
But fortunately for us, we have the Iteracare device and we can bring it anywhere. And we can have sunlight all the time.
So
Ah,
it's your
Absolutely.
first
Take
aid.
advantage.
Amen.
Go for it.
actually, I forgot. I forgot. My cousin is here. Pina, can you, ano? Pin,
Doctora, may I ask if the Iteracare ba is a negative ion?
No,
It's not?
it's not negative ion. It is terahertz energy.
Terahertz. Terahertz, not negative ion. Okay, thank you.
Yes, you're welcome.
yeah, andito sana si Pina, pero I don't know if she's, I'll just ask sana kung what is the condition of my uncle. Pin, can you switch, can you unmute, Pin? Pina? Parang hindi siya nakikinig. Baka uncle ko yung nandyan. Oh, anyway. Okay. So, my uncle kasi, maga yung left foot niya, and then yung throat niya may problem. Tapos, very weak. Tapos yung kamay
Ikaw na,
niya,
Daddy,
very
kumain.
weak. So,
You just
Yeah.
blow on those areas.
just blow on those areas. Right. Okay. Okay, so that's it. Doctora, we thank you so much for
Yes, you're welcome.
accommodating us tonight.
Anytime.
You want
Yeah.
us to take photo before Doctora leaves? Can you
Yes.
turn on your video? Sige ha.